What if I told you that the absolute best fever remedy your grandmother knew about isn't sitting in your bathroom medicine cabinet? It's actually hiding right there in your refrigerator. Welcome to This Explainer. Today, we're diving into a highly effective natural refrigerator secret that Southern mamas, Amish grandmothers, and Portuguese fishermen have sworn by for generations. And honestly, the science behind it might totally surprise you. While Big Pharma isn't exactly advertising this, thousands of parents swear it works like magic when things like Tylenol and Motrin just completely fail.
You know, we are so conditioned to just immediately rely on Big Pharma and whatever pill bottle happens to be sitting on our bathroom shelf. But we really need to ask ourselves, what if the absolute most effective way to handle a fever isn't in that cabinet at all?
Well, the surprising truth is that it's sitting right next to your milk and butter. We are talking about 3 incredibly basic kitchen ingredients that combine to make a powerhouse fever remedy. And the best part about this, as we're going to see, this isn't just some random old wives' tale. It's totally backed by both rich cultural tradition and some seriously fascinating clinical data. Here is our quick roadmap for this explainer. We're going to cover the refrigerator remedy itself, talk about rethinking the fever, dive into the 4 mechanisms of action, walk you through the exact step-by-step method, check out some real parent results, and finally, we'll go over the critical safety rules you absolutely have to follow. All right, let's jump right into part 1, the refrigerator remedy. So where does this incredible wisdom actually come from? Well, the crazy thing is, using egg whites to treat a fever pops up across multiple different cultures completely independently. Back in the American South during the 1800s, this tradition was passed down through African American and Appalachian folk medicine. It's actually heavily documented in the University of North Carolina's oral history program. Then, moving into the 1900s, we see Amish communities using what they literally call anti-fever socks, while at the exact same time, Portuguese fishermen were carrying that identical tradition across the Atlantic. Fast forward to 2018, and this remedy was formally tested in traditional Chinese medicine. And that test perfectly illustrates why this is so much more than just folklore. In 2018, a master's thesis out of Guangxi University tested 120 children using a medicated egg bath therapy. The results? They saw a massive 94.9% antipyretic or fever-reducing success rate. That's compared to just 82.5% in the control group. I mean, that is a staggering difference, and it's completely backed up by real clinical data.
Let's move on to part 2, rethinking the fever.
Now, before you go trying to lower a fever, we really need a quick paradigm shift here. Fever is your body's weapon, not the enemy. Research from the National Institutes of Health actually shows that higher body temperatures increase your white blood cell production by up to 50%. And at the exact same time, that elevated temperature decreases the iron, zinc, and copper in your bloodstream. That is brilliant because bacteria actually need to feed on those minerals to reproduce. So your body is literally starving the bacteria while simultaneously boosting its own defenses. Let's contrast these 2 approaches for a second. On the one hand, you have your natural fever defense. It's actively killing microorganisms and breaking down viral cells before they can even replicate. On the other hand, we have what happens when you suppress that fever with medication. Studies actually show that reaching for acetaminophen, ibuprofen, or aspirin reduces your antibodies and inhibits that crucial white blood cell production by up to 50%. It's even been shown to increase adult cold symptoms and prolong the itching and scabbing in kids fighting chickenpox. So the goal shouldn't be to just destroy the fever, but to gently manage it so your body can do its organic work. All right, part 3, 4 mechanisms of action. So how exactly does soaking your socks in egg whites support this natural process? Well, the first mechanism is evaporative cooling. Egg whites are about 90% water. When you put them on the skin, that water evaporates and literally draws the heat away from your body. But here's the secret weapon. Egg whites contain a protein called albumin. This albumin creates a thin, flexible layer that holds on to moisture way longer than plain water would. An NIH study actually points out that maintaining skin moisture to promote evaporation like this significantly reduces core body temperature. The second mechanism relies on the really unique anatomy of the soles of your feet. You see, the soles of your feet have 0 sebaceous glands, meaning there's no oily sebum blocking the way, and their pores are highly absorbent. It's the exact same reason organic health advocates love applying essential oils to the feet. Because there's no sebum, your feet absorb the egg white incredibly fast, allowing the cooling effect to kick in much quicker than if you put it anywhere else on your body. Next up, the third mechanism is thermal regulation. This is a classic naturopathic hydrotherapy response. Wet sock therapy has actually been used for over a century because when you apply cold to the feet, it forces the blood vessels to expand to generate heat. This triggers what's known as a heating compress response. It pushes immune cells super efficiently throughout your entire body, activates your lymphatic system, and even helps reduce upper respiratory congestion.
And that brings us to our fourth and honestly most mind-blowing mechanism, gamma globulin. This is an antibody protein that provides immense immune support. And guess what? Big Pharma charges around $20 to inject synthetic gamma globulin into your arm as a flu shot, but egg whites naturally contain this exact same compound. When it's absorbed through the skin, it provides amazing localized immune support. In fact, papers in ACTA Scientific Nutritional Health have documented egg white compresses resolving overnight breast mastitis, healing post-surgical wound infections, and clearing up severe foot inflammation in a matter of hours.
Which brings us to part 4, the step-by-step method. Okay, we know the science. Now, how do you actually do it? Let's walk through the exact method. All you need are 2 raw eggs, a paper towel, and a pair of socks. Step 1, separate the egg whites and whisk them up until they're nice and frothy. Step 2, take a paper towel or a thin cloth and completely saturate it. Don't wring it out, you want all that moisture. Step 3, place it directly onto the sole of each foot. Step 4, cover it up with regular socks. You can even slip a plastic bag over the sock if you're worried about getting your sheets wet. Step 5, just leave them on for 20 to 30 minutes or until the paper towel feels dry. And step 6, check the temperature. You should see a drop in about 10 to 20 minutes. Most parents find they only need to do this once or twice before their kid falls peacefully asleep. Let's take a look at part 5, real parent results. Don't just take my word for it, though. Let's look at what real parents and patients have been reporting on the Earth Clinic database over the past 2 decades. The results are just incredible. We've got a child whose stubborn 103.6 fever dropped to 102.7 in just 15 minutes, which let them finally get some sleep. An 11-year-old went from 102.8 down to 100.6 in 18 minutes. A 14-month-old dropped over 2 degrees in an hour. We even have a record of an adult with a post-surgical fever of over 103 degrees who used this exact egg white method, started cooling down within 15 minutes, and entirely avoided a trip to the ER. These are powerful, specific stories proving this rapid fever reduction is definitely not an isolated phenomenon. Finally, part 6, critical safety rules. Now, as much as we absolutely love organic, natural remedies on this channel, I need to be very clear about a few safety rules. While highly effective, this remedy isn't for everyone. First, absolutely no infants under 3 months old. Any fever in a newborn means you need immediate medical care. Second, do not use this for fevers over 104 degrees Fahrenheit. Third, definitely do not use this if the person has an egg allergy, because even skin contact can trigger a severe reaction. Fourth, always use fresh eggs and wash the shells with soapy water before cracking them to avoid any salmonella contamination. And lastly, this is never a replacement for a doctor. If a fever persists for more than 72 hours, or if it comes with a stiff neck, confusion, trouble breathing, or a rash, you must seek immediate medical attention. So I'm going to leave you with this question. Are your most powerful remedies already sitting right there in your refrigerator? We've seen how centuries of cross-cultural tradition brilliantly converge on 3 super simple kitchen items: eggs, socks, and paper towels. This explainer really highlights how we can gently lower a fever and stay comfortable without suppressing our body's completely natural, necessary immune response. It really is organic health at its finest. If this explainer opens your eyes and helped you rethink what's in your medicine cabinet, be sure to hit that subscribe button for more unique health secrets. Until next time, stay curious.